FABMs and FABMs through FemTech, they exist largely outside of the healthcare system.
Do you see a connection between these methods as a group and the MAHA movement, making America healthy again?
I really think that there's some crossover both in kind of the values and the way that the particularly femtech is answering some of these values-based changes within the MAHA movement. For example, I think that one of the values of the MAHA movement appears to be kind of a distrust of larger regulatory bodies and traditional
Right.
healthcare providers. And and FABMs through FemTech, they exist largely outside of the healthcare system. So you don't need a provider to start them. You don't need a provider to stop them. You kind of can do it on your own, which I think is kind of a kit within that value.
Self-care.
I think a big part of the MAHA movement is this backlash against this perceived environmental toxicity. I think there's been a lot of conversation around the perceived environmental toxicity of hormonal contraception. So the fact that these don't have any sort of hormones that are being introduced into either the body or the environment as they're excreted, I think is kind of in line with this MAHA movement. And also, I think that there's kind of this idea of the individual taking primary responsibility for their health decision making. And I think these types of methods are really easy for somebody to do that. So you can pick up a technology, you can get the information on your own, and you can utilize that to make the decisions on your own. So I think there's a lot of compatibility between these current movements. And I think that's why you're seeing a lot of it being pushed to the forefront as
Right.
well.